Good morning, everyone. Today, I will present the typology of 21 nursing problems of Faye Glen Abdellah using the Ali Good and Tommy evaluation tool. Sit back, relax, and enjoy. Faye Glen Abdellah was born on March 13, 1919, in New York City. She was born to a father of Algerian heritage. That explains why her last name sounds like something else, though she was born in New York and her mother was a Scottish. She graduated magna cum laude from Fitkin Memorial Hospital School of Nursing, now Anne May School of Nursing in Neptune, New Jersey. What motivates Faye Glenn Abdella to become a nurse? On May 6, 1937, Abdella and her brother witnessed a German hydrogen fueled airship Hindenburg exploded in Lake Worth, New Jersey. The incident became the turning point in Abdella's life. It was that time when she realized that she would never again be powerless to assist when people were in so dire need for assistance. As she quote, I could see people jumping from the Zeppelin, and I didn't know how to take care of them. So it was then that I vowed that I would learn nursing. Faye Abdallah is a woman who is not afraid to cross boundaries if it was for the welfare of a patient. When she used to teach at the Yale University, she was forced to educate from a textbook that had no scientific background to nursing principles. Being the activist she is, Abdallah decided to take matters into her own hands. She burned the books in a fire at the Yale University courtyard. Needless to say, Abdallah is a captivating woman as she is a leader in the nurse research and science field. Faye Glenn Abdallah was the first nurse and the first woman to serve as a deputy surgeon general. Her hard work changed the focus of nursing from disease centered to patient centered and began to include the care of families and the elderly in nursing care. She authored more than 150 publications related to nursing care, education for advanced practice in nursing, healthcare administration, and nursing research. She has been granted 11 honorary doctorates by various institutions, and these honors recognize her work in nursing research. She was then inducted into the National Women's Hall of Fame in the year 2000. Dr. Abdallah's patient centered approach to nursing was developed inductively from her practice and is considered a human needs theory. She chaired the National League for Nursing Committee on Records, and she developed a meaningful clinical record for professional student nurses. She then identified three barriers to its task. First, the lack of clear definition of nursing. Second is the current philosophy of nursing education was cherished but not practiced. And third, nursing education curricula were not patient centered. Using a typology of nursing problems that was developed in 1953, the original 58 problems were refined to 21 and validated with the assistance of a faculty from 40 basic collegiate schools of nursing. This resulted in the publication of patient centered approaches to nursing in 1960, at least three research studies over a 5-year period. Theory structures illustration focuses on the pendulum. The core concept of the theory of Faye Glenn Abdallah are represented by the idea of the focus of care pendulum. She seems to swing the pendulum to the opposite pole from the disease centered to nursing centered while leaving the client somewhere in the middle. This implies that the patient centered approach should be the priority for a nurse. The foundations of the theory are fairly simple, yet they serve their purpose of providing nurse with options that will allow designing the best approach towards meeting patients' needs in the clinical setting. In Abdellah's theory, we have two major concepts, the nursing problems and the problem solving. In the nursing problem, this includes the 21 nursing problems that fall into three categories. We have the physical, sociological, and the emotional needs of patients. She used Henderson's 14 basic human needs and nursing research to establish the classification of nursing problems. Moreover, patient needs are further divided into four categories, which includes basic to all patients, sustenance care, remedial care needs, and restorative care needs. Basic to all patients' needs to maintain good hygiene and physical comfort, like, for example, after colonoscopy, patients are usually soiled from the procedure. It is therefore important to clean them properly. Second, to promote optimal activity, exercise, rest, and sleep. Patients, for example, who are sedated during the procedure stay in the unit until the effect of the sedation has decreased to a safe level. As a nurse, make sure the patients are able to rest and sleep. Third, to promote safety through prevention of accident, injury, or trauma. One way we prevent the spread of infection is through proper inspection of the equipments, bed alarm, proper lighting at all times. And the fourth one, to maintain good body mechanics. By what? Positioning the patient properly, allowing for the normal anatomical position of the body parts. Problems number 5 until 11 falls under the category of sustainable care needs. Fifth, facilitate the maintenance of a supply of oxygen to all body cells. So when patient manifest breathing problems, oxygen is attached to them. Sixth, to facilitate the maintenance of nutrition of all body cells. Like for example, patients undergoing endoscopic procedures are on NPO or nothing per RM. Seventh, to facilitate the maintenance of elimination. So we provide bed pans or urinal to patients, and at times we insert Foley catheter when the patient is not able to void. Eight, to facilitate maintenance of fluid and electrolyte balance, proper regulation of the intravenous solutions. Ninth, to recognize the physiological response of the body to disease condition. It may be pathological, physiological, and compensatory. For example, patient with dengue. It is but important to check the patients for signs of bleeding by monitoring the blood pressure and the capillary refill. Tenth, to facilitate the maintenance of regulatory mechanisms and functions. When a patient has a difficulty in breathing and is showing an increased respiratory rate, elevating the head part of the bed is done to facilitate the respiratory function. And the 11th, to facilitate the maintenance of sensory function. For example, when a patient is admitted who is already deaf and mute, we cannot communicate to them by body language to maintain their basic need despite of inadequacy to the sensory function. Problems 12 until 18 are remedial care needs. So number 12, to identify and accept interrelatedness of emotions and organic illness. So we encourage patients to verbalize their feelings and allow them to cry when they have the need to do so will help them emotionally. 13th, to identify and accept positive and negative expressions, feelings, and reactions. Most of our patients feel anxious before undergoing procedure, so it is necessary to listen to the patient's expression and allow them to ask questions to decrease their anxiety. 14. To facilitate the maintenance of effective verbal and nonverbal communication. So, for example, when patients are not able to express themselves verbally, it is important to assess for nonverbal cues. For instance, when patients are in pain, assessing for facial grimacing. 15th, to promote the development of productive interpersonal relationships. So we allow the patient's significant others to stay with the patient before and after the procedure. This allows for bonding and promotes interpersonal relationship. 16, to facilitate progress towards achievement of personal and spiritual goals. We nurses usually visit the patients in the unit, so patients may benefit from this, allowing them time to practice their faith. 17, to create or maintain a therapeutic environment. So we should provide proper lighting, then therapeutic surrounding uh, for a healing process. And of course, Number 18, to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. So, care to patients vary according to their developmental needs. We allow the parents to stay during the procedure if the patient is a child. It helps the pediatric patient in their emotional and developmental needs. Problems 19, 20, and 21 are restorative care needs. So, number 19, to accept the optimum possible goals in the light of limitations, physical and emotional. So, the goals for each patient vary depending on the capability of the patient. Number 20, to use community resources as an aid in resolving problems arising from illness. For example, some patients live far from the city, and thus referral to health centers is sometimes done. Or another example, shelter homes for victims of abuse, support groups for depressed patients. And number 21, to understand the role of social problems as influencing factors in the cause of illness. So some patients who are diagnosed with, for example, amoebic colitis, for instance, are advised to avoid buying street foods to which the preparation they are not sure of, and also avoid drinking water that are not safe. Essential to Abdellah's theory is the correct identification of nursing problems for which the nursing skills included. The 11 skills are as follows: observation of health status, skills of communication, application of knowledge, teaching of patients and families, planning and organization of work, use of resource materials, use of personal resources, problem solving, direction of work of others, and lastly, therapeutic use of the self in a nursing procedure. In the concept of the meta paradigm, the characteristics of humans are not identified. It's just that, according to Abdallah, patient is described as the only justification for the existence of nursing. And for health, it does not give a definition of health. Though total health needs and healthy state of mind and body in her description of nursing as comprehensive service. As for environment, home or community from which the patient comes. Society is included in planning for optimum health on local, state, and national and international levels. And in nursing, according to Abdallah, nursing is based on art and science that mold the attitudes, intellectual competencies, and technical skills of the individual nurse into the desire and ability to help people, sick or well, cope with their health needs. The second major concept is the nursing problem. So, the nursing problem presented by a client is a condition faced by the client or client's family that the nurse, through the performance of professional functions, can assist them to meet. The problem can be either covert or covert nursing problem. So when we say overt nursing problem, it is an apparent condition faced by the client or the client's family in which the nurse can assist him or them to meet through the performance of her professional functions. While a covert nursing problem is concealed or hidden condition faced by the patient or family in which the nurse can still assist him or them through the performance of her professional functions. The 21 nursing problems can be applied through a nursing process. In the assessment phase, for example, nursing problems provide guidelines for the collection of data. A principle underlying the problem solving approach is that for each identified problem, pertinent data are collected. So the overt or covert nature of the problem necessitates a direct or indirect approach, respectively. In nursing diagnosis, the results of data collection would determine the client's specific overt or covert problems. These specific problems would be grouped under one or more of the broader nursing problems. This step is consistent with that involved in nursing diagnosis. As we all know, in nursing diagnosis, we have the diagnosis and then the related factor, and then the evidence by. In planning phase, the statements of nursing problems most closely resemble the goal statements. Once the problem has been diagnosed, the nursing goals have been established. So, as we all know, in planning phase, this is where we put our goals, the short term goals and the long term goals. In the implementation, using the goals as the framework, a plan is developed and appropriate nursing interventions are determined. In the evaluation phase, the most appropriate evaluation would be the nurse progress or lack of progress towards the achievement of the stated goals. So, how it directs critical thinking in nursing practice. So, in our nursing practice, Dr. Abdellah's typology of 21 nursing problems has helped nursing professionals in dealing with patient care in an orderly and well structured manner. In using this typology, a nursing professional with a problem solving approach is able to make out patients' problems, plan for his care, and implement nursing interventions for the identified problem in a scientific manner. This problem solving method has transformed our practice as we attempt to focus our attention to the client himself rather than focus on client's medical condition, which is more of the objective of the medical profession. Nursing professionals have also learned and understand the rationale behind each and every action we deliver to the client.